Today, we're talking with Laurie Menekou, the founder of Conceptual Communications, about a two-part case study she and her team put together regarding a campaign they managed for the city of Stamford, Connecticut Department of Health. Laurie, thank you for joining us. And what a nice way to present a case study.
Thanks so much for having me. I'm very excited to chat with you about this project. It's an interesting one because it really sheds light on just how important the roles of communications professionals are.
Absolutely.
The pandemic's been a disruption for many communities, obviously. From your experience working with municipalities, what would you say are the unique challenges that cities face as it relates to the pandemic?
So, two things really came to light during the pandemic in terms of marketing and communications, and for public information officers, especially. The first thing was the amount of misinformation and disinformation that's out there. I mean, we knew it, but it was a true aha moment of, oh my goodness, we really can't control what other sources and sources that have zero credibility are putting out there, and people are actually believing it. The second thing that came to light during the pandemic for communicators was twofold. One, the ADA compliance. So making sure messaging is accessible. So you have people who truly need information in a way that they could see it or hear it or listen to it. And then there's people that use Spanish, Portuguese, French, Creole as their first language. And information was not necessarily being published in that manner on a wide scale. And when it comes to public health, that certainly should be available. So, major lessons learned: one, disinformation, misinformation, widespread. How do you combat that as a credible source, a city, a public health agency? And two, the accessibility of information were two major points that were definitely uncovered that were challenges.
Wow.
Well, specifically focusing on the city of Stamford, what were the driving needs the city was looking to address that they were working with you on?
So, government recognizes a need, right? If we have a need to educate the public. In this case, one of the aspects we were educating on were the vaccines. So there's a lot of education that goes into explaining to people what's happening, and things were changing so quickly and information was moving so quickly, and it was all so new. States, I think, had the foresight to say, okay, we really need to put effort into this and have a strategic approach when it comes to communications from the public health perspective. So let's provide some grant funding. The city of Stamford got some grant funding to help educate their residents. And this was true for many communities throughout the country that took this approach.
So now that we understand what the city needed to address, can you share the challenges that you and your team were faced with?
In short, my firm was awarded a contract in June 2021 to handle communications for the health department regarding COVID-19 vaccine equity programs, prevention, and testing. So essentially finding ways to effectively educate Stamford residents about COVID-19 vaccines, testing, and prevention methods that are available to them.
And given the time and the timing, just 1 year into the pandemic, that's really a tall order.
It was because as communicators, we already knew that a lot of the messaging other communities were putting out wasn't working.
Mm-hmm.
For example, when it came to getting messaging out about the vaccine, there was a lot of imagery about showing a vaccine vial and a syringe.
Yikes.
And we immediately realized that our work had to be different, right? Vaccines can be scary. Nobody wants to get a shot. So we knew we had to take a softer approach.
What was the solution that you and your team came up with?
It was really twofold. We knew people had a lot of questions, and we really wanted to communicate that that was okay. One of the concepts, again, that we learned early on from the public health officials was even though COVID was new, the vaccine technology being used wasn't. And for all of us who are not health professionals, that's an important distinction. People needed to hear that, to process that, and then have a chance to respond. Nearly every flyer, social media message, web posting we put out communicated that it was okay to ask questions and get the information that you needed, being you, the resident or the stakeholder, from a credible source like the health department, and then make the decision that was best for them. We wanted that information sharing to come from credible outlets. And in order to do that, we needed to let people know that it was okay to have that dialogue and that it was really welcomed. The second part of the solution leaned heavily on using community voices. So government agencies have a tendency to use a hardline approach. Think of messaging again early on, like get your vaccine. And that can be off-putting. Nobody wants to be told what to do.
Yeah.
So we chose to really focus on the positive. We knew people in the Stamford community were getting vaccinated, and we wanted to understand why they were doing it. So we ultimately decided in the beginning stages of our work with the health department not to spotlight government or public health officials, but rather residents and working professionals in the community who had chosen to get their vaccine. So our goal here was really to elevate the voices of people who already understood the importance of getting vaccinated so others could hear them and hopefully identify with them in some way. So it's basically neighbors talking to neighbors.
I love it. That sounds really insightful. Did it work?
Yes, it did. And we have some numbers to back it up. The campaign was really successful. And within the first 6 months or so, we actually saw a growth of about 2,000% of engagement on the Department of Health social media platforms. And we had a 493% audience growth digitally across their platforms. So that told us that people were engaging with our content because it was people they recognized. It was the pastor, it was a neighbor, it was their neighbor who's getting ready to go off to college. And then they were staying connected with the health department. So now we were connecting them to a credible information source. And we were fighting against one of those first big challenges that I had mentioned early on, which was the misinformation and disinformation. We did a lot of video content spotlighting residents. They shared why they got their vaccine. We also did a lot around the messaging that it's okay to ask questions. And of course, some general education about testing and prevention. So through all of that, we secured in those first 6 months just over 85,000 video views just from social media alone. There were other media campaigns, but yeah, it was pretty good. And then, of course, I'm sure you're wondering, well, did the vaccine rates increase?
Yeah. Like, did it really work?
Yeah, we were asking that too, because that would be their ROI. So the most important metrics are, of course, yes, the vaccine rates did increase. We were really also successful in reaching Hispanic residents and Black residents, communities that are sometimes not as in touch with information that could be available to them. Again, there might be a language barrier. Maybe it's not being produced in different languages. And in this case, we were producing things in Spanish and in Creole very regularly. And by month 7, we saw a 34% increase in vaccine rates among Hispanic residents and a 22% increase among Black residents.
Wow.
And then we also saw a 16% increase among young adults, which was also a sub-target for us. So that 18 to 24-year-old group. And not only did we see an increase in vaccine rates, but we increased vaccine rates among those who were vaccine hesitant. It was kind of an added bonus.
That is amazing.
Yeah.
I mean, it sounds like these results were really impressive. I imagine your work is still ongoing with the Department of Health?
Yes, we are continuing our work with the health department. In fact, we just concluded a separate outreach initiative about the lessons learned from the pandemic. And I really look forward to sharing that case study with you in part 2.
Yeah, we're looking forward to it. Thank you again for sharing your work with us. For more information about the work Conceptual Communications does for their public sector clients, visit conceptualpr.com.